Hello, everyone. Happy April. Welcome to our April Community of Practice meeting with Social Prescribing USA. I am Jen Kuo, and today we have with us a guest speaker, Don DeVries from Michigan, who's going to be sharing with us about recreational therapy, what it is, and how it plays a part in social prescribing. So without further ado, let's welcome Don. And Don, handing it over to you to do your intro and your presentation. Thank you for being here with us today.
Great. Thank you, Jen. Let me pull up my PowerPoint for you to follow along and see what's happening. It's great to be here with you. I've been a part of the social prescribing community, this group for a while, kind of in the back scenes. And when Lenny sent out an email about, oh, does anybody want to share what they do? I jumped on the opportunity because some of you may have never heard of recreational therapy. We often are a discovery major at the undergraduate level and aren't very well known unless you have a family member that's kind of received services. So I thought I would take the opportunity to tell you about recreational therapy and what we do as a profession, and then talk about partnerships and ways that we can work together and how we use social prescribing ourselves. So I look forward to providing this talk and sharing information with you to help you learn a little bit more about what we do. So first slide is just who I am. I'm an associate professor and the program director of recreational therapy at Grand Valley State University in Grand Rapids, Michigan. Grand Rapids is located on the west side of Michigan, and we are the second largest city in Grand Rapids. I mean, in Michigan. Most people know of Detroit, of course, and that's on the opposite side of the state. And Grand Rapids, we're the second largest city, and we're on the opposite side of the state. So I've been a practitioner and an educator and a whole bunch of other things. And so I have a lot of toes in different practice areas. So I hope to bring some different perspectives to you. So in being here today, my goals are to introduce you to what rec therapy is, to talk about the connection between rec therapy and social prescribing, and then to talk about what rec therapists do within social prescribing, and just start to lay a foundation of thinking about how as multiple disciplines, we all come together and we all kind of fit into this picture and this process that can really transform lives. So just to start, what is recreational therapy? Recreational therapy is a systematic process. We have a structured process, just like every profession does, where we assess our clients one-on-one, we plan our interventions, we rate goals, we implement those interventions, and then at the end we go back and evaluate. And maybe somebody is ready to move on to another level or a higher level of independence and they no longer need us, or maybe we have other goals that we can work on. But we utilize recreation and other activity-based interventions to address the needs of people. And we primarily focus on working with people who have disabilities. That's the majority of people that we work with, but we will also work with people that have chronic conditions or are living through adverse circumstances. So thinking, for example, of youth who are classified as at risk. That might be a group that we as a recreational therapist would work with. But we work with all different kinds of diagnoses and conditions, from the little kids that are born with disabilities like cerebral palsy or Down syndrome, all the way through adults who may be living with Alzheimer's or are receiving end-of-life care due to a terminal condition. And we are focused on promoting the psychological and physical health, recovery, and well-being of people. And so those are words you see in social prescribing as well, that psychological and personal well-being. We are focused on restoring, rehabilitating, or helping people maintain their abilities and skills for as long as possible, and so that they can be independent and have an optimal quality of life. We work in a variety of clinical and community settings. So recreational therapists, you'll find them in settings from physical rehabilitation hospitals to inpatient psychiatric hospitals to skilled nursing facilities or special care units. You'll also find us in community parks and recs programs where they have an adaptive recreation program where maybe they're doing some adaptive sports. Um, and more and more rec therapists are starting to practice in community settings similar to home health agencies. With the changes in a lot of states' Medicare, Medicaid programs, a lot of recreation therapists are able to provide services under Medicaid waiver programs to help people stay in their homes and their communities as long as possible rather than moving into a residential long-term care type of settings. And so we use our experience and our expertise to help people overcome barriers that they encounter. And so a lot of what we do is adaptations. It's helping people learn to modify the activities, the recreation and leisure activities that they enjoy doing, whether that's connecting them with adaptive devices similar to what an occupational therapist would do, or helping them learn a new skill, like somebody who has an acquired spinal cord injury, helping them learn to ski using a sit ski instead of obviously standing up. And so those are a couple of the things that as rec therapists we do. So let's find my cursor here. There it is. So just a little bit about our background is we are qualified at our qualification, our credential is a CTRS, and that stands for Certified Therapeutic Recreation Specialist. And that's the credential that's described as the qualified provider of recreational therapy. The National Council for Therapeutic Recreation Certification is our credentialing body, who ensures that we meet those requirements to take the credentialing exam and then that we maintain our education. And so we are required, over a 5-year cycle, like a lot of health professions are, to obviously undertake continuing education, have ongoing training, and to obviously be engaged in our profession. We start, unlike some of our other therapy colleagues like physical, occupational, or speech therapy, recreational therapy practice starts at a bachelor's level for entry. And so our clinicians don't have to get a master's to practice like some of those other professions. A lot of them will go get a master's, but they don't have to start practicing. So if you have experience with a rec therapist, or even as we look at social prescribing, as a field, you're going to run into bachelor's prepared, and that's okay because that's what's required for our profession. So you have to have a bachelor's degree. We have certain requirements of anatomy and physiology and certain amounts of psychology, and then a clinical internship that we complete as well, like a lot of other professions. So that's just a little bit about our background. So but our foundations as a field, I think you're going to find a lot of similarities to what we talk about with social prescribing. And so you'll see, I'm going to show you 2 models that recreational therapists use in practice, but you're going to see positive psychology integrated throughout what we do. We focus a lot on social determinants of health and delivering that holistic perspective. And as we look at disability, we are not people that focus on a medical model. We really look at that biopsychosocial model. And so if you think about the International Classification of Functioning and like the WHO models of disability, that's where rec therapists fall. We look at disability as a societal imposed barrier or challenge, that there's so many things around us that make a person not be able to function in society the best that they can or as independently as they can, whether that's architecture or societal attitudes. But all of those other factors obviously influence a person's ability to be independent and functioning. And so we're looking at the whole person, not just their physical ability, but their emotional and their physical and their cognitive and their creative aspects of life and the things in their environment, whether that's their background or the demographics that they live in or the conditions, and looking at how that affects the whole person and their functioning. And so we're really focused on that holistic perspective. And like social prescribing, our ultimate goal is we want people to have the highest sense of well-being that they can and quality of life. So through this individualized approach that I explained, that process that we use as rec therapists, we're using then recreation and leisure as meaningful activity to address people's physical functioning, and their social functioning and their cognitive functioning and their emotional well-being. It's not one dimension. We're really focused on how all of those pieces pull together and fit together to create or influence us as individuals. And so we seek to try to eliminate barriers as much as possible to promote that quality of life. Um, we kind of tap into some of the stuff that public health might do with health promotion and prevention. Again, looking at people with disabilities, we know that there's a lot of secondary conditions that develop. Physical things like pressure sores for people that are using wheelchairs regularly, but also, mental health issues like depression and anxiety from such rapid and significant changes for people that have an acquired injury, or the long-term challenges that people face when they have a disability, the socioeconomic barriers that arise. And so we work on promotion and prevention as well to, again, promote that quality of life. So, our focus with our clients is really broader than these three things, but I kind of felt like these three things kind of encapsulated. And knowing that we had like a 20-minute presentation to talk, I wanted to keep it simple. And so when we're working with clients, and again, this can be little kids that have a developmental disability, or older adults, we are looking at meaningful activity. We want to help people find purpose, meaning, and involvement in their community. We are really looking at improving function, but also that health promotion aspect of all the benefits that come from doing things that are important to you as an individual, and how those impact and enrich our lives in so many ways. We're looking at purpose. So we're going to use activities that are of interest to you. That's what motivates us, right? We want to do things that we find interest and passion in. We also do a lot of work with coping skills related to illness, disability, or adversity, and how to deal with those things that happen in life that we can't avoid, or uh, to help build our resilience, right? Because then we're better able to deal with all of the things that come with us. And of course, we're trying to promote independence. We want people to be able to do as much for themselves as they possibly can. And I'm sure many of you know that when you have a disability or a chronic condition, you're often being cared for. Other people are giving you care. And it's just as important that we, regardless of our ability, can give care and be involved in things that matter to us and that we can contribute. And so that's something that we really seek to do. And what I see as a really important connection to social prescribing is that community, that connection to a larger group of people, but then also being involved in our individual communities to go to arts events, to go to the coffee shop and restaurants with friends, and to be a part of the culture that exists in our communities is really important. And then, like I keep saying, quality of life, quality of life, quality of life. We know that having chronic conditions and disabilities can adversely affect people, their self-esteem, their connection to other people, their purpose, their function. And so we're trying to do what we can to help people overcome those barriers through adaptation, revising, looking at different ways of doing things, but then again, looking at that holistic approach on sometimes our attitude is a barrier to what we do. We limit ourselves. And so helping people to see what their potential is and to really achieve that becomes important as well. So I've kind of grouped it down into 5 kind of focus areas of what a recreational therapist does that you'll see some overlap with social prescribing. You'll probably see some overlap with some other healthcare disciplines that you have experience with. As I talk about these, it's probably going to ring some bells, but one of the things that recreational therapists do is we'll do adaptations and modifications. So I gave that example of somebody who loses the ability to use their legs and wants to continue skiing. Okay. We have lots of the world has evolved into accepting adaptive sports. We now have Paralympics, and hopefully some of you have been able to see those. Most of those athletes have worked with a recreational therapist at some point in their life to gain exposure to that sport. And so, again, we're helping people learn those new skills to accommodate their past interests. We also do what's called leisure education, and this is something that is unique to recreational therapists and part of the education that we provide. And leisure education, eh, thinking about our society, we are evolving, which is good because we've been so work heavy, right? That good American individualistic perspective. You work, 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 right? And we're shifting more to life balance, but there's a lot of people who don't know what they like to do or how to access it or what their values are and how what they do reflects that. And so leisure education is all about helping people become aware of what leisure is and start to identify their values and how that can connect to other meaningful activities that they can engage in. Part of that leisure education does overlap with social prescribing, and it's helping people find resources, right? You like to do this, well, what's available to do that in your community? And so that's all part of that process that recreational therapists utilize. And again, our focus is typically with people who have disabilities or chronic conditions. So leisure education is something that we frequently use when we're working in mental health settings. And we use it a lot with people who have substance use issues, right? Because when we abuse substances, we kind of have habits. And we maybe have a group of friends that we drink with regularly, or we go to the bar and we shoot pool or play darts, and right, we have activities that are become connected to the activity. And so helping people learn healthier choices and how do you break some of those habits and how do you develop new relationships when all of your drinking buddies aren't willing to give it up, right? And how do you deal with that? Coping skills are a huge part of what we do. Everything from behavior management to emotional regulation to helping build self-esteem. And so working with youth that have eating disorders, teaching them coping skills and healthy ways to use leisure is important. We do a lot of things with people that have autism and working on, social skills, but also on behavior regulation and community settings. And of course, mindfulness, right? That connection again to social prescribing. We also do a lot with connection and socialization, whether that's helping people learn and develop skills, but also addressing loneliness. And this has been a huge issue that recreational therapists have been focusing on more so since COVID, during COVID, and after with older adults. Older adults we know became really isolated during COVID, and recreation therapists have really been doing a lot to get people re-engaged, to address that loneliness through programming or getting people back engaged into their community. And then, of course, connection. And as I keep bringing up disability, people with disabilities often become isolated themselves because they don't see or don't have the opportunity to engage and develop relationships with people that have the same conditions as them. And so helping people connect through support groups or leisure groups or through just community events where they get to be with people that have similar abilities is really important. And then, like I mentioned, we're working on functional skills and abilities to help people function as independently as possible, and then to be able to engage in those activities that are meaningful to them as independently as possible. So on my slide here, I'm just giving you a kind of overview of a lot of different interventions that recreational therapists will use. And I didn't want to give you 20 slides, so I just gave you a brief thing, but I've mentioned a lot of these things already. So like adaptive sports is really important. And then you're going to see things that really connect well with what social prescribing is doing, and that's arts and music and bibliotherapy and horticulture and nature, right? Those are so important, right, to get people connected to those creative aspects of life and to nature and to ground ourselves in those things that really connect us to our humanity and connect us to each other. But there's other things that you'll see here. Recreational therapy, we'll use aquatic therapy, we'll do animal-assisted interventions, we'll do everything from anger management to coping skills groups to using video games. Video games are great to work on balance. I don't know how many of you used to use your Wii, right, when they were really popular. That is a great balance activity for people that have balance impairments. So what, you can't go out to the golf course? Okay, we'll do it on Wii, and we're going to work on some of the same things you would on the golf course and just build up your abilities. So this slide and the next one, they might be a little hard to read. I realize Jennifer said she was going to send stuff out, so you'll be able to see it a little bit closer. But I picked two models that we as recreational therapists use that I thought really showed a deep connection to social prescribing. And so on the left side, or it's my left side, I guess it's more of the table looking with the person standing with their arms up, and then the arrow. We're looking at this perspective of what we do as people and what we need in our lives, and then how a recreation therapist works with people to help them achieve that well-being, which is represented in the flower. And this is called the Flourishing Through Leisure model. And you'll see some of the language in here that really reflects social prescribing. And so I think that there's a really good partnership between recreational therapy and social prescribing. So just looking at the middle area, the facilitation of social strengths, we're, like I've shared, we're working on communication skills and interpersonal skills, reciprocal relationships, and we're doing that using community resources, using other resources to promote inclusivity and diversity, to engage in meaningful social roles, to have peer support and development, and to then work on other accommodations the person might need. And through all of this, right, we are enhancing the person's leisure experiences, helping them to experience authentic leisure and things that are really important to them, and engaging and finding those social supports and connections and being involved in our environment and our community. And that obviously affects all the domains of functioning, which are represented in the flower. Each petal is kind of a different area. And again, it's that well-being that we're ultimately promoting with environmental resources and supports, and then building on that person's personal strengths. The other model that I quick wanted to just show you is called the Leisure and Well-Being model. And you'll see some of the components that I've talked about to enhance people's leisure experiences. We're obviously looking at the environment and the physical resources they have, cognition, social abilities, and then all of the psychological things like capacity for happiness to autonomy and self-determination. And all of those obviously lead into our well-being, which contribute to our positive affect and emotion, but then also cultivate our full potential as humans, right? And there's this reciprocal or back and forth relationship between our well-being and our involvement in the things that we love and enjoy. Okay, and through all of that, again, we're just kind of promoting our well-being. So The next slide is just I got from the Public Health England about social prescribing. And I'm sure some of you have seen this before, but I hope that this slide kind of shows you uh, things that I've talked about that connect really well with recreational therapy and social prescribing. Again, working together on that holistic perspective, helping people find local and non-clinical resources and services to support them. A lot of times, with recreational therapy, we're working a lot in inpatient settings or residential settings. And so when people are being discharged, say from a rehab hospital after, recovering from a stroke, and sometimes we're serving as that link worker in that social prescribing model because we're the ones helping them find those resources. Well, now that you're going home, here's how you continue. Here's where you can find an art class that's in an accessible studio. Or if you want to go to the symphony, here's how you order wheelchair accessible tickets, right? And that's part of what the recreational therapist is doing inpatient as somebody's getting closer to discharge. And then in the community setting, we're obviously helping people to engage in those activities while they're living in the community. So my last slide just really talks about social prescribing, and um, I think the overlap and the way that we work together and that recreation therapists can embrace social prescribing, because we as a field haven't are starting to dip our toe into seeing what social prescribing is. I think there's a role for recreation therapists, just like I think there's a role for a lot of other professions. But we're both looking at social prescribing and RT. We're focusing on that holistic care and well-being. That, like I've talked about, that integration of arts and nature is so critical. I mean, it's amazing what nature can do. The power of being outside, just having your hands in the dirt, right? Releases these endorphins and these positive chemicals that our body needs to find meaning and purpose and to be happy. Um, and so there's definitely connections for that. That community involvement, our outcomes, the engagement and just being involved in what's around you. Again, I think those are a lot of the areas that we overlap. Social prescribing, is connecting people to social activities and resources in their community. It's essential for all of us. We as rec therapists are, again, more focused on working with people with disabilities or chronic conditions and helping them overcome barriers. So like that's kind of a unique perspective that recreation therapy can bring, is getting people into their community, helping them overcome some of those challenges that maybe as able-bodied people we don't think about, and helping them find accessible resources so that they can become involved in their that they can participate and be involved in their community. So I think this as going forward, I think rec therapists can definitely be a part of social prescribing and the movement that you all are supporting as we again are working with people with disabilities and older adults. Older adults may be going to their doctor, community doctor, and then as they transition into a residential setting like assisted living or a nursing home, the rec therapist can be a part of that and help them continue to either be involved in those things that they've engaged in while they were in the community, or help them find ways to get back involved in those, within the setting that they're in. So my last slide is just a couple of, if you want to explore further, I will, Jennifer's going to send these out with the links. So the American Therapeutic Recreation Association is our professional organization. Recently, as January 2025, our blog talked about the intersection of social prescribing and rec therapy as kind of an introduction for rec therapists to start thinking about. And then I also included information on our credentialing body in case, again, anybody's curious. But I think that there's some tremendous and great opportunities for recreation therapists to be a part of social prescribing and then to support the work that you are all doing in your communities, and then ways that we can collaborate and work together again to help people have this meaningful connection and the involvement that brings joy to our lives. Because what's life without that? So, um, I haven't had a chance to look to see if there's any questions, so I'm going to do that quick and
Yes, well,
make
thank
sure.
you. Thank you so much, Don, for that very informative presentation and well said on that last statement. So yes, we're open to taking questions and having discussion to learn from each other. So I do have first question. I'll start us off, Don. Is I'm sure you've heard this before, and I'm sure others are wondering too. Is what is the difference between recreational therapy and occupational therapy?
Yeah. So, occupational therapy has been around a little bit longer. So, recreational therapy came out of World War II, and serving veterans in particular. And that's where our roots start. We started out being called hospital recreators, and our focus was on helping injured veterans return to their communities and to daily life. Um, Occupational therapists and rec therapists, again, different degree levels, we overlap in the aspect of leisure, right? And OT focuses on occupations, and we are focused exclusively on that recreation and leisure component. A lot of times, particularly in inpatient settings, occupational therapists are, and again, this is partly because of insurance, right, is focusing on doing activities of daily living, grooming and eating and dressing and hygiene and toileting. And occupational therapists in inpatient settings don't have the opportunity to focus beyond those activities of daily living because of prescriptions, right? And because of how insurance and Medicare and Medicaid pay. And recreation therapists can fill that gap. We can help people return to their leisure. A lot of times people will work with physical and occupational therapy, and as they're getting closer to discharge, that's when the rec therapist will enter in to start to provide services, because somebody's getting ready to go home or back to their community, and we want to help them adjust to that and integrate back into their community. And so the rec therapist might provide community integration services where we're going and practicing getting into restaurants and how do you get groceries when you're in a wheelchair versus when you were walking. Um, and so that's one of the big difference. OT has to focus on those activities of daily living, and we can focus more on that recreation and leisure component.
Thank you. And you're getting lots of appreciation in the chat for you. Thank you so much, Don.
Yeah, thank you.
Anyone in the group want to share a question in the chat I can read out loud, or go ahead and unmute your mic?
I've just put my
Go ahead.
email. I just threw my email in there because I don't think I put it on my presentation. So there it is if you want to follow up or shoot me an email for work. I did see, how does one get referred to a recreation therapist? And it really depends on the setting, and not every hospital has a recreation therapist. Unfortunately, that's my goal in life. No, recreation therapists, you're going to find them in a variety of settings, in a variety of places. In inpatient settings, so when we're talking about like an inpatient rehab, um, we are included under Medicare and insurance reimbursement just as a standard service. We don't bill separately like a PT or OT or speech would. And so physicians can refer to the recreation therapy program or to the adaptive sports program and do it that way. In inpatient settings or inpatient psychiatric settings, recreation therapists are in that activity therapy category, activity therapists, which can include creative arts, so art and music therapy, as well as occupational therapy. The majority of activity therapists are recreational therapists, and there's a handful of OTs kind of scattered in there, and then music and art are what make that up. In skilled nursing facilities, that a lot of times rec therapists may serve as the activity director overseeing the diversional or the engagement type of activities that are provided to all people that live in the nursing home, but then they can provide some specialized interventions that are more therapeutic, more focused on addressing coping skills and physical functioning and adaptation to help the older adults with that. So I hope that answers that question.
And Dennis asked, what evaluation criteria do you use to measure service success?
Yeah, so it really depends on the setting because we work in such diverse settings. It really depends. So, like, again, for some things, like thinking about working with people on coping skills, we may use self-assessment, a pre and post test to see how the person feels about that. We're going to look at things, have they continued? Are they improving in their areas of functioning? So it really depends on what type of interventions or what our goals are. So when I've worked with older adults, I've done a lot of falls prevention programs with older adults. And obviously, I'm looking at a decreased number of falls. I'm looking at improved range of motion. I'm looking at balance stability. So I'm going to use assessments like the timed up and go to assess somebody at the beginning before I'm providing interventions and then at the end. So we do try to quantify what we're doing and look at outcomes. A lot of times too, with our push to getting people engaged in their communities, we're going to look at, are you actually doing it? Like, we create a plan with you. Now, are you following through on it? Are you finding satisfaction in those activities? Is it bringing more meaning to your life? Are you running into barriers and that type of thing? So we are looking at outcomes, and it really depends on what kind of treatment interventions and goals we have with a client. Yeah, and Becky, I love that you're working on dementia-friendly libraries. That's awesome. I've been involved in some dementia-friendly community work and some dementia-friendly university work where we're trying to provide some opportunities for older adults to even be a part of college life with undergraduate students.
Yes, and thank you, Becky, for that question. You're welcome to also reach out to Dawn to offline about whether or not she has any knowledge of recreational therapists working with public libraries too.
Yeah, yeah,
You kind of touched upon this earlier in
yeah,
your presentation about how RT can kind of, because currently we know in the US system, we don't have a link worker specific
yeah,
role, which is
right.
what the UK uses a lot. So there's different types of role that is filling that gap for us in the US.
Yeah,
So you mentioned how RTs can sometimes be that link worker. So there's a common question here that SP programs are newer in the States, but
yeah.
has there been exploration to playing the link worker role in addition to the more higher skill levels? If you kind of expand on what you mentioned earlier.
Yeah, yeah. No, that's a great question. Not at this point. And that's one thing that I'm interested in as I've been learning more and more about social prescribing over the past year as I've been involved with this group, I've been wondering that as well as where's that role? And again, even if it's a more specialized role because of focusing on disability, right? That there's opportunity there, and we have not looked at that as a profession. And I think that's definitely an opportunity because that's all we do, right? We're working with people with disabilities all the time. And so I think, as a field, we have a good idea of what works and doesn't work. And again, working on the individual with basis with people, we can help adapt things to fit their needs. And so I think there is potentially a role for that kind of, I don't want to call it a consultation, but that rec therapist could help adapt some things for people that do have disabilities. Again, as we hope and as people are getting more involved in their communities and staying out of long-term residential settings.
Got it. And feel free to anyone else drop in questions or unmute your mic. Kind of expanding on Becky's question in the chat. Can you speak a little bit to your knowledge about the percentage, the ratio of those RTs working in like the healthcare setting versus community-based settings? And I think that's what's more, I think I'm more curious about as well, with Becky
Yeah,
is for community settings, how are they selected? Is it libraries? You mentioned parks and recs.
yeah, yeah. So a lot of it depends on the state, to be honest. And um some of the big cities in the country have recreation therapists in their parks and recreation departments because of the large disability population. I live just outside Grand Rapids, like I said, is the second largest city, and my town has a huge adaptive recreation program, and they have specialized program for senior adults where a rec therapist is involved, and they also have disability specific services that they provide as part of Parks and Rec in the community. The clinical outreach, so there are other places where rec therapists are doing outpatient programs. So inpatient rehab or outpatient rehab. So they might be affiliated with the outpatient clinic and a rehab hospital. Anybody from Chicago, Shirley Ryan has a huge rec therapy presence, helping integrate patients from inpatient to get them involved out in their communities through outpatient services. And then there's these kind of individual companies that run similar to home health, where you can get a referral and then a rec therapist will do an assessment, that type of thing. Some states that have waiver programs, that have Medicaid waiver programs, have those companies as well that work with the specific population that the waiver program is for. So, for example, Indiana and Texas in particular have large waiver programs for people with developmental disabilities once they age out of the school system, so 21. So 21 and up, and they're working on helping people with developmental disabilities get involved in their communities through community integration. So it really all depends. And I don't know exactly the percentage, Jennifer, what your question was. I'm not sure the percentage of inpatient to community based, but as we're seeing in healthcare, right, more and more stuff is shifting to community based. And so we're seeing growth in positions for recreation therapists in their communities too.
Awesome. These are wonderful questions, and thank you for taking the time to share your knowledge and insight. Next question is, are you aware of any hard data on cost savings to the national health system for social prescribing activities?
Yeah, I know we, as a field for rec therapy, we have a couple of studies that have shown some cost savings long term for people with disabilities after they've received service, that they've had better outcomes when they have a rec therapist on their team, and then their outcomes being discharged from the inpatient setting to the community are better and last longer. I do not know specifically about the social prescribing aspect of it, because again, that's kind of newer to our field and definitely something that needs to be explored.
Thank you. And I think that's one aspect we were all looking towards more, is that cost savings report. I know Canada put one out recently for the Canadian Social Prescribing Network. So yeah, more to come.
Yeah, more to come. And just feel free to shoot me emails afterwards too. I if you're like me, like you think of things after the fact. Oh yeah, I should have asked that. So feel free to email me. I'm happy to get back to you, or to talk individually with people if you want. Happy to do that.
Thank you so much, Dawn. Any questions, any burning questions for Dawn in this space? Yes, England also released some cost savings reports. We just got to get more here for us to do that case making, right? Awesome. Thank you so much, Dawn.
Thank you. My pleasure.